Welcome to Artemis Interactive Media. Artemis is your guide to learning resource supplements and content overview for continuing education. This resource will cover dawn phenomenon and Somogyi, understanding the differences. At Artemis, you can take aim and score with helpful resources in the description. There you will find study guides, practice questions, and other resources you might find helpful that you can put in your binder and use while you study. This QT is a quick timeout for a short study break. It will cover dawn phenomenon and Somogyi, understanding the differences. Dawn phenomenon and Somogyi are conditions experienced by people with diabetes mellitus. There are similarities in blood glucose levels, such as early morning hyperglycemia, etc. The treatments are vastly different. In fact, the treatment for one of these conditions may seem counterintuitive until we understand the pathology of the disease process. Some of the similarities include normal or elevated evening blood glucose and early morning hyperglycemia. There are some differences between Somogyi and dawn phenomenon. With dawn phenomenon, the blood glucose around 2 or 3 a.m. is normal or elevated. There is no release of counterregulatory hormones. The blood glucose elevation in the morning is due to that steady rise throughout the night. With Somogyi, the blood glucose around 2 or 3 a.m. drops. Due to the early morning hypoglycemic episode, they have a release of counterregulatory hormones to increase the glucose level. The blood glucose level is due to the rebound from the hypoglycemic episode. With dawn phenomenon, there's usually no night terrors or night sweats because they don't go hypoglycemic. With Somogyi, they do go hypoglycemic around 2 or 3 a.m., so they may have night terrors or night sweats due to the sympathetic response. The treatment for dawn phenomenon is to prevent the blood glucose elevation. The way we do that might include more medication at night. We also would not increase an evening snack. The treatment for Somogyi focuses on preventing the hypoglycemic episode. We do that by maybe less medication at night or an increase in the evening snack. There are a few things to remember. With dawn phenomenon, the blood glucose rises like the dawn, which means it's just a steady rise. We need to prevent the rise in blood glucose levels. With Somogyi, it's sometimes low, sometimes high. We need to prevent the drop in blood glucose around 2 or 3 a.m. to prevent the rebound hyperglycemic episode in the morning. With dawn phenomenon, no nightmares, no night terrors because they don't have that adrenergic response. They didn't go low in the middle of the night. Whereas Somogyi's, they may have night terrors or nightmares because they have that sympathetic response. The healthcare provider will need to obtain a 2 or 3 a.m. blood glucose level to determine if the cause of early morning hyperglycemia is caused by dawn phenomenon or Somogyi. It's time to test our knowledge. Dawn phenomenon and Somogyi can be complicated topics to understand. They have different causes for increased blood glucose levels, and therefore the treatments are different. The following questions will test your knowledge on the material we covered in this resource, so please answer the 5 following questions to gauge your mastery of this material. Artemis will appear when we need her to help us make sure that we've answered the questions correctly. Question 1. What are common findings for morning glucose levels for dawn phenomenon and Somogyi? A. Decreased morning serum glucose in dawn phenomenon only. B. Elevated morning serum glucose levels. C. Decreased morning serum glucose levels. Or D. Increased morning serum glucose levels in Somogyi only. Okay, Artemis, help us out. And the answer is B. Elevated morning serum glucose levels. Question 2. People with dawn phenomenon experience which of the following? A drop in serum glucose with a steady rise by 7 a.m., a rise in serum glucose around 2 a.m. with a rapid drop by 7 a.m., A steady rise in serum glucose with morning hyperglycemia, or a steady drop in serum glucose? Okay, Artemis, give us a hint. And it is C, a steady rise in serum glucose with morning hyperglycemia. Thanks, Artemis. Question 3. People with Somogyi experience which of the following? A drop in serum glucose around 2 to 3 a.m. with a steady rise by 7 a.m. A rise in serum glucose around 2 a.m. with a rapid drop by 7. A steady rise in serum glucose with morning hyperglycemia. A steady drop in serum glucose. I need help. Come on, Artemis, help me out. And it is a drop in serum glucose around 2 to 3 a.m. with a steady rise by 7 a.m. Thanks, Artemis. Question 4. The treatment for Somogyi may include which of the following? Decreased carbohydrate intake in the evening. Decreased protein intake in the evening. Increased snack at night. Or increased insulin intake at night. Come on, Artemis. Give us a hint. C. Increased snack at night. Well, that makes sense because people with Somogyi have early morning hypoglycemia around 2 to 3, and the increased serum glucose level is due to the rebound. Thanks, Artemis. Question 5. The treatment for dawn phenomenon may include which of the following? Increased carbohydrate intake in the evening, increased protein intake in the evening, decreased insulin intake in the evening, or increased insulin intake in the evening. Okay, Artemis, help me out. D, increased insulin intake in the evening, which makes sense because people with dawn phenomenon have a steady rise in glucose that leads to early morning hyperglycemia. Increasing insulin intake in the evening may prevent that. Thanks, Artemis. Thank you for your attention. This presentation may be used for content review and clinical competencies for pre-conference and post-conference education. This quick timeout, or QT, can also be used for a short study break. Dawn phenomenon and Somogyi involve more than this QT covers. For more information on these disorders, please contact your instructor and refer to your textbook. This content is under copyright protection and may be used with permission from developers. Please visit artemisinteractivemedia.com for more information. You can also find helpful information from our own references on this slide.